What if your heart was failing and you had no idea? Millions of people walk around with undiagnosed heart disease, believing they're just tired, stressed, or out of shape. But heart disease is silent, progressive, and often deadly. It doesn't always start with chest pain. It can be fatigue, dizziness, or even trouble sleeping. Could you be at risk? Welcome to Levitas. What does it mean to have a heart disease? Heart disease isn't just one condition. It's a group of disorders that affect how the heart functions. It can be a problem with the blood vessels, the heart muscle, the valves, or the heart's rhythm. Some heart diseases develop slowly over time, while others appear suddenly and without warning. Having heart disease means that your heart isn't working efficiently, which can reduce oxygen supply to the body, increase strain on the heart, and raise the risk of complications like heart attacks, stroke, or even sudden cardiac arrest. Early detection and the right lifestyle changes can make a huge difference. How common are heart issues? Heart disease is the leading cause of death worldwide, affecting millions of people every year. In the US alone, about 1 in 3 adults has some form of cardiovascular disease. Some heart conditions, like arrhythmias or mild valve disorders, can be managed or cured with medication, lifestyle changes, or surgery. However, diseases like advanced heart failure or severe coronary artery disease may be progressive and irreversible. While many cases can be treated, the key to survival is early detection and proper management. Ignoring the warning signs can be fatal. What is coronary heart disease? Coronary heart disease, also known as CHD, occurs when the arteries that are constantly supplying blood to the heart become narrowed or blocked by plaque buildup. This condition, known as atherosclerosis, develops over decades, often without symptoms until it's too late. But why does this happen? The main culprits are high cholesterol, high triglycerides, high blood pressure, smoking, diabetes, obesity, and poor diet. Over time, fatty deposits harden inside the arteries, restricting blood flow. This can cause angina, which is basically chest pain, shortness of breath, or in severe cases, a heart attack. But can it be fatal? Yes, coronary heart disease is the leading cause of heart attacks. If a blocked artery stops blood flow completely, heart tissue starts to die within minutes. Without urgent medical treatment, the heart can completely fail. So, how can you fix this? Lifestyle changes. Like a heart-healthy diet, exercise, and quitting smoking can slow plaque buildup. Also, medications like beta blockers and blood thinners may improve circulation. Medical procedures like angioplasty, stents, or bypass surgery restore blood flow and prevent heart attacks. What is heart failure? The main function of the heart is to pump blood to your whole body. So, heart failure doesn't mean your heart stops beating. It means it can't pump blood effectively. This happens when the heart muscle weakens or stiffens, leading to fluid buildup in the lungs, swelling in the legs, and severe fatigue. What causes this? Because heart failure is often caused by high blood pressure, coronary artery disease, heart attacks, or diabetes. Over time, the heart works harder and harder, becoming too weak to meet the body's needs. And if you ask, yes, this issue can be fatal, untreated heart failure is progressive and deadly. It can cause organ failure, fluid in the lungs, and sudden cardiac arrest. How can you fix this? Medications can help. Drugs like ACE inhibitors, diuretics, and beta blockers help reduce strain on the heart. Lifestyle changes are a massive factor. Reducing salt intake, lowering carbs, losing weight, and managing stress improve heart function. Devices and surgery, including pacemakers, defibrillators, and heart transplants may be necessary in advanced cases. What are arrhythmias? An arrhythmia is an irregular heartbeat. It can be too fast, which is known as tachycardia, too slow, or bradycardia, or completely erratic. Some arrhythmias are harmless, while others can be deadly. Why do they happen? Arrhythmias occur when the electrical signals that control the heartbeat malfunction. This can be caused by high blood pressure, heart disease, electrolyte imbalances, stress, caffeine, or even genetics. Can they be fatal? Yes, certain arrhythmias, like ventricular fibrillation, can cause sudden cardiac arrest. Others, like atrial fibrillation, increase the risk of stroke and heart failure. What can you do about it? Medications, like beta blockers, anti-arrhythmic drugs, and blood thinners help stabilize heart rhythm. Lifestyle adjustments, like reducing caffeine, managing stress, and staying hydrated, prevent episodes. Medical procedures like cardioversion, Ablation therapy or pacemakers may be necessary for severe cases. What is valvular heart disease? Heart valves control blood flow, opening and closing with each heartbeat. When they become damaged or don't close properly, blood flow can be totally disrupted. Why does it happen? Causes include aging, infections, high blood pressure, and congenital defects that can lead to valve disorders like stenosis, which are narrowed valves, or regurgitation, which means having leaky valves. Is it fatal? Yes, severe valve disease can cause heart failure, blood clots, and sudden death. Can it be fixed? In mild cases can be treated with medications like diuretics and blood thinners, which help reduce symptoms. In severe cases, valve repair or replacement surgery is required to restore normal blood flow. Aortic heart diseases. The aorta is the largest artery in the body. Aortic diseases affect this critical blood vessel, leading to life-threatening conditions. Types of aortic diseases include aortic aneurysm, which is a weak spot in the aorta that bulges like a balloon, risking rupture, and aortic dissection, meaning a tear in the aortic wall that causes internal bleeding and is often fatal. Why do they happen? They are mainly caused by high blood pressure, genetic conditions, connective tissue disorders, or trauma that weaken the aortic wall. Can they be fatal? Yes, aortic rupture or dissection is a medical emergency with high mortality rates. Is there a solution for this? Blood pressure control, with medications like beta blockers, reduce strain on the aorta. Surgery to aneurysm repair or aortic grafts prevent rupture. What are the best ways to prevent heart disease? Preventing heart disease starts with small daily choices that protect your heart over time. These include eating a heart-healthy diet, with focus on whole foods, lean proteins, healthy fats, and fiber-rich vegetables. Exercising regularly for at least 30 minutes of moderate activity daily, which strengthens the heart. Maintaining a healthy weight is key, since excess fat increases blood pressure, cholesterol, and diabetes risk. Managing stress, because chronic stress triggers inflammation and raises blood pressure. Quit smoking, since tobacco damages arteries and doubles heart disease risk. Monitor blood pressure, cholesterol, and triglycerides. Regular checkups detect problems before they worsen. Getting enough sleep is very important, since poor sleep contributes to high blood pressure and irregular heart rhythms. A healthy heart isn't just about avoiding disease, it's about living a longer, stronger life. In conclusion, heart disease is an umbrella term for a wide range of conditions that affect the heart's and vascular system, structures, and functions. It can involve blocked arteries, weakened heart muscles, faulty valves, or irregular heartbeats. Some forms develop slowly over time, while others strike suddenly and without warning. The consequences can be severe, leading to heart attacks, strokes, or even sudden cardiac arrest. Coronary heart disease is the leading cause of heart-related deaths, triggered by artery blockages that restrict blood flow. This condition is fueled by high cholesterol, high triglycerides, high blood pressure, smoking, and poor diet. If untreated, it can result in a heart attack. Heart failure, another major threat, occurs when the heart becomes too weak or stiff to pump blood properly, leading to fluid buildup, organ failure, and extreme fatigue. Other deadly conditions include arrhythmias, where abnormal electrical signals disrupt heartbeats, and valvular or aortic diseases, which impair blood circulation and can cause sudden heart failure. The good news is that many of these diseases can be prevented or managed. Heart-healthy diets, regular exercise, stress control, good sleep, and avoiding smoking dramatically lower the risks. Monitoring blood pressure, triglycerides, and cholesterol can catch problems early, ensuring a longer, healthier life. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.